So I'm just wanting to welcome you. I am Barbara Boyer, the Executive Director here at AgeWise Colorado. Bob Brocker, who is our founder and board president, couldn't make it today. So you get stuck with me. And I will go through this just ever so briefly. Today's speakers are Amy Hadlick. Amy, I am sorry. Hadlick.
Sorry, no, it's okay. It's a tough one.
Pronounce it.
Halatic. Insert
Halatic.
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 I should have said that for you before we started.
Thank you. I meant to ask because I mess it
It's
up
a
all the
tricky one.
time.
It's the halatic.
Yes. Jen Gomer and Kelly O'Connor. And this will, because it's recorded, you can reference more of these information on the bios when you visit the website. We do ask that you turn off your camera and you mute yourself. If you have any questions as we go along, we will do them at the end. And if you'll put them as in the chat box as you think of them, we'll take care of them again as soon as we're finished with all the speakers. We want to remind you we're AgeWise Colorado. We connect you to trustworthy service providers. We do these webinars several times a month that you can reference at any time. I think this is number 60. So there are a lot on our website that would be very informative to you. We are all volunteers, so if anyone is ever interested in volunteering, we would love to talk to you. And of course, we are a 501c3, so we always appreciate donations. Here, this is our website for future reference, just in case you need it. And with that, I am going to stop sharing my screen and turn this over to Amy. After Amy, Kelly will speak, and then we'll hear from Jen. So Kelly, thank you. It's all yours.
Amy's got it.
I'm sorry, I did it again.
Amy Halatic here. I gotcha. We're good. Thank you, Barbara. I'm so happy to be here today. As Barbara said, again, my name's Amy Halatic. I'm here with Care Coordinators of Colorado. Today, I'll be presenting on what care management is and how we support the aging population. But before I begin, I want to share one of the reasons why I chose this profession. In 2019, I experienced a tragic event with my dad. He had an unexpected healthcare crisis that lasted about a month and resulted in his passing. In that time, he lost all functional capacities, the first of which being his ability to speak. I became his full-time caretaker and advocate for all of his needs. I also realized when making decisions, there was no advanced care plan to help me take control of the situation and be able to make healthcare and in-home care decisions. Through these personal events and many years background experience with the aging population, I was able to envision what others might be experiencing with their aging parents and how I could use my expertise to help family members and their loved ones. Today, I'll be introducing you to care management. And I apologize if you hear my dog in the background. He's been completely silent until I decided to start speaking today. As I present today, you'll be hearing two interchangeable terms: geriatric care managers and a more modern term, aging life care professionals. Aging life care professionals have relevant education, professional backgrounds, and experience working with the aging population and their families. These standards are set by the Aging Life Care Association. We play a crucial role in helping the aging population maintain their independence, managing chronic conditions, and navigating the challenges of aging. We provide invaluable support to families who may be struggling to balance the demands of caregiving with their own needs and responsibilities. We ensure that our clients' needs are met at all levels of care, even down to the smallest details. thus allowing family members and caregivers to free up time and energy to spend more quality moments with their loved ones. In this way, geriatric care managers can be seen as the project managers of aging well. What do care managers do? Once a partnership with a geriatric care manager is established, the first step is a face-to-face visit with the client and, if possible, their family member or caretaker. During the visit, we conduct a comprehensive evaluation to observe the individual and their home environment directly. This includes a functional and mental health assessment, a home safety check, and a review of the community resources currently in place. We also identify any gaps in care that need to be addressed. Additional things that might be assessed is the level of social isolation, ensuring that they have adequate transportation options to medical appointments, errands, and social activities, and evaluating their ability to complete daily living tasks. We also examine their personal hygiene and the cleanliness of their living environment to identify any areas that need support. An example of an area we assess would be the individual's ability to take a shower, including how frequently they bathe, whether they receive assistance with this task, and the condition and accessibility of the shower itself. Overall, both their mental and physical acuity, we assess both their mental and physical acuity, looking for signs of cognitive decline, depression, and other health concerns that may affect their daily living. After completing this thorough evaluation, we develop a personalized care plan and set clear goals. We use a team approach, collaborating with healthcare providers, family members, and community resources. We also refer to experts in various fields and find the best resources for support, such as home health aides. Our goal is to ensure the aging individual receives the best possible care and support, whether they are aging in place or transitioning to a new living environment. When to use a geriatric care manager. Some examples of when an aging individual would use a geriatric care manager. My first example is of a solo ager. Someone without close family or immediate support works with a geriatric care manager to ensure their needs are comprehensively managed. The care manager provides crucial support by coordinating medical appointments, medication management, and home services, and advocating on behalf of the healthcare providers and care facilities. In emergencies, we act as an immediate contact, handling urgent situations and navigating the healthcare system. We also offer routine check-ins, monitor health changes, and assist with transitioning to new living arrangements, financial management, and legal matters. Additionally, we connect the solo ager with social activities and community resources, ensuring their quality of life and emotional well-being is maintained. When an aging individual is no longer safe and to live in their current environment and needs to transition from their home to an assisted living facility, a geriatric care manager plays a crucial role in facilitating a smooth and supportive move. Once a most suitable option is identified, the geriatric care manager oversees the entire moving process. This may involve arranging for movers, handling the transfer of belongings, and making sure the most important items are unpacked and set up in a way that aligns with the aging individual's routines and preferences. In the new environment, the geriatric care manager continues to play an essential role. We work closely with the facility staff to ensure the individual's specific needs are met, whether they require assistance from daily activities, medical care, or social engagement. An example of when a family member would hire a geriatric care manager might be during the holidays when family members are visiting their aging loved ones. They might notice changes that weren't apparent before. The home may be in disarray, bills might not be paid, or new physical limitations could be evident. If the family lives far away and can't be there regularly to assist with caregiving or can't visit often, a geriatric care manager can serve as the local support. We can monitor the individual's situation, coordinate essential services, and keep the family informed about their loved one's condition and needs. The care manager provides the eyes and ears for the family members to keep them informed about the needs of their loved one. Geriatric care managers support the aging population in various settings based on the individual's needs. We coordinate in-home care, assuring safety and accessibility, and oversee care in assisted living and nursing homes to advocate for the quality and meet the individual's needs. In hospitals and rehab centers, we handle care coordination and discharge planning. We assist those in memory care units with specialized support and help residents in independent living communities with service and future planning. For our clients in adult day centers, we ensure proper care and activities. We also work with individuals in hospice care to provide comfort and support. At community and senior centers, we connect seniors to social programs. Additionally, we can assist during and post-transitioning to new living environment and/or dealing with other significant changes. I'd like to summarize our role as an aging life care professional and how we support individuals and their family members by using 8 key areas defined by the Aging Life Care Association, or ALCA. I will start with crisis intervention, as this is often when advice from a professional is needed the most. In an event of a medical emergency, we can assist a client through hospitalization and rehabilitation, coordinating with care and keeping the family informed, especially if they live far away. In regards to health and disability, as an aging life care professional, we might attend the client's doctor's appointments to ensure that medical instructions are clearly understood by the client and the family, and coordinate necessary home health services for someone who requires daily care, for example. Next is financial. As an aging life care professional, we might help a client manage their bills, consult with an accountant, or assist in navigating insurance claims to ensure financial matters are handled smoothly. Housing. If a client is no longer safe in the home, we might help a family evaluate with the client if the client should move into an assisted living facility or stay at home with modifications in the home and in-home care services. Or family. If family is struggling with caregiving responsibilities or disagreements about long-term care, we can mediate, helping them reach a consensus and manage emotional challenges for caregiving. Local resources. We would connect a client with a local senior center that offers social activities, meals, and transportation, making sure the client has access to community resources that meet their needs. And advocacy. If a client requires specific medical care, the aging life care professional could communicate with health and care providers to ensure the client's wishes are prioritized and their needs are met. And finally, in terms of legal, an aging life care professional might refer a client to an elder law attorney to draft a will or establish a power of attorney, ensuring the client's legal affairs are in order and that their preferences are legally documented. Aging life care professionals will often step in as a professional healthcare agent or a guardian. Aging life care professionals and geriatric care managers work closely with our clients and their families and caregivers to manage healthcare needs, legal concerns, financial matters, housing decisions, and family dynamics. Aging life care professionals also advocate for their clients, connecting them to local resources, intervening in a crisis, and developing personalized care plans that adapt to the changing circumstances. It was my pleasure to have the opportunity to share the importance of care management in the aging community. Again, my name's Amy Hladik with Care Coordinators of Colorado. Attached is my information, and I put a QR code to my website on the top left. I've also shared the information for the Aging Life Care Association with their website attached to the bottom QR code on the right. And then I think we'll take questions at the end. So I appreciate the time today.
Thank you, Amy. And let's move on to Kelly, please.
All right. Good morning, everyone. Thank you so much for joining us. And Amy, thanks for that comprehensive overview of care management. It was really great to see. I know I've worked with many care managers over the course of my career and always appreciate what they provide to the clients. So thanks again for that presentation. And especially thank you to Barbara for inviting me to speak here today. I will go ahead and share my slides. And I have been working in the senior living world for about 14 years. I've had different roles and responsibilities. Today, I am representing the Society of Certified Senior Advisors. I am a certified senior advisor. I have a small private practice where I do elder care consulting, some family, I call it a facilitated family conversation. Which is basically, some people call it an intervention with a family. But I am here representing the Society of Certified Senior Advisors, and we are an organization that happens to be based here in Colorado. And I'll tell you a little bit about our organization, what we do, and why you might consider hiring a certified senior advisor or bringing a certified senior advisor onto your team. So the next thing I was going to show you is I have some initials after my name. And I bring this up because I want to show you and illustrate the differences in what the initials might mean and how you can do some research on the people that you're working with. The first of those is I hold a master's degree in psychology. I like that to be first and foremost. It took me a long time to be able to get that degree. And a lot of people in our industry, you can see them with nursing degrees, with social work degrees. Mine happens to be in psychology. So I do have a lot of clients that I am able to work with on that level. I am a certified senior advisor, CSA. I'm also a CPRS, which is a certified placement and referral specialist, and a CDP, which is a certified dementia practitioner. I keep the certified dementia practitioner last on because it is a certificate that I received. I took an 8-hour class, and that is how I got my certified dementia practitioner certification. So while it may seem like, you know, it's a big fancy title, it's simply a certificate. And the reason why I wanted to illustrate the differences in a certificate, it's someone who takes a class, passes a basic exam or not, maybe it would be a certificate of completion, is because the certified senior advisors is a full certification program, and I'll be able to illustrate that for you. So to start off, I wanted to give you some statistics on the aging industry that you may or may not be familiar with. The number of seniors are expected to nearly double in the United States to 95 million people by the year 2060. And this is the reason why you see so many different professions coming in to the industry, and the reason why people are really excited about what we're doing in our industry to support older adults. The average life expectancy in the US is around 79 years, and that is going up. So in working with planning, whether it's a care manager or a placement agent, you know, having to look and see where you are in with finances is really important, because we're living longer than we expected to when we started making some of our retirement financial decisions. And by the year 2030, the demand for senior care is expected to grow by 41%. And approximately 80% of older adults have at least one chronic condition requiring some sort of specialized care. There are some great people in our industry that are doing amazing work caring for individuals that are experiencing dementia, those with Parkinson's disease, and so forth. So making sure that clients get the right care is really important. A few more statistics, and I only have 2 more slides on stats, so I won't bore you with it. But it's really important to understand what's happening in our industry for professionals. So the need for home care aides is expected to grow between now and 2029 by 34%. We're experiencing in the metro area and in some of the rural areas, we are experiencing a shortage of care workers, and that will intensify as the need grows over these next few years. The cost of care is high and it's rising. So, you know, in the past couple of years, post-COVID, costs of home care and assisted living have gone up tremendously. I'm hoping that Jen will be able to cover some of that information with you. And then Medicare and Medicaid are changing so quickly that consumers really must educate themselves on these programs so they understand the benefits that they're getting. Those benefits are changing. And this year, my friends that are in the Medicare world are telling me this will be one of the most significant Medicare enrollment periods in history of Medicare. So it's something to really pay close attention to. And then there's technological advances that are helping in this industry. And a lot of people are coming into our industry doing telehealth, remote monitoring, and offering assisted devices. And culturally, everyone thinks that the senior population is one thing, that we need to treat people as, you know, one thing as seniors. And what we're finding is it's becoming more and more diverse with varying cultural, ethnic, and socioeconomic backgrounds. So each individual really deserves the dignity of being treated with with that individual respect. We are experiencing a high turnover in the industry. We have always experienced a high turnover in our industry, and it's really due to the nature of the work, how physical care work is, and also the emotional demands on the care workers themselves. But many people do find that the work in senior care is the most impactful of their life. I know that I've found that as well. So a little bit about the Society of Certified Senior Advisors is our Certified Senior Advisor designation is not a profession. It is actually a credential. So to be a certified senior advisor, you can be an expert in any field that that you are in. Currently, you can be an elder law attorney, you could be a direct care worker, you could be a care manager, you could be a senior living placement agent. You could also be a financial advisor. We have a lot of reverse mortgage specialists, so we have a lot of people that are a part of our midst. And we are a multidisciplinary credential. So experts come to us that are already in their field, and they're looking for a holistic view of aging with classes on health, legal, government programs, physiology, financial literacy, and ethics. And so what we're doing with our certification is we're certifying a body of knowledge so that you know that when you meet a certified senior advisor, not only are they an expert in their field, but they are also certified in and specialist of aging in our midst. And we provide a lot of professional development for all of our certified senior advisors on a monthly basis. I'll go over some of that in a little bit later. But I think one of the most important things that we do is we really allow professionals to see the older adult as a whole person and understand more about the complexities older adults face as they age. I know, you know, I've heard from financial advisors who are there to help people plan for their retirement and their long-term care, and someone gets a really tragic diagnosis, and all of a sudden the financial advisor doesn't know how to interact with someone at that level. And so we really provide that holistic view and are able to allow professionals to really see someone as the whole person. So on my next slide here, we do have a basic education program that's called Working with Older Adults. We offer online classes, virtual classes, in person. We are, as I said, based here in Denver, but we do have classes throughout the United States. And especially with the advent of our virtual classes, we have wonderful group discussions with people from all over the country on those classes. And then what happens, this is the process for becoming a certified senior advisor, is you complete an application and a candidate information profile. There are disclosure questions that we want to know about someone's background. They must pass the certification class. And I will say that I do sit on the certification committee, or the education committee, I should say. And it's a pretty rigorous exam to pass. We want to make sure that, you know, people that do have our credential are really up to speed on what it means to age in America. The next thing that we do, which is different from a lot of certifications, is we do a very thorough background check. We also require that CSAs have an ethics module, and they agree to maintain their certification through us, and they must abide by a code of professional responsibility. And so we must complete the background check and 30 hours of continuing education credit every 3 years. We have a wonderful compliance officer here at the Society of Certified Senior Advisors. We are also scanning the news all the time to make sure that everyone is using our certification in correct ways, looking on social media, and that also if there were anything that were to come up with someone's ability to maintain their professional responsibilities, that we're on top of that. The CSA credential, we have 4,000 certifications in the US, and there are less than 10% that are credentialed. So I mentioned the certified dementia practitioner. I took an 8-hour class and I received a certificate. So this is why certification is really important, to understand how you can distinguish the quality of the education and the rigor that it takes to maintain certification. So of the certifications that are in the US, less than 10% are credentialed and less than 1% are duly credentialed. So we have 2 national accrediting bodies that are constantly looking at our curriculum, constantly looking at our processes and looking at our membership to make sure that we uphold the highest of standards. And then we also, with these governing bodies, there's a third-party verification and oversight with stringent guidelines that they require of us. And again, our compliance officer is on top of all of that. And then next, one of the big benefits, I think, for older adults and their families is to know that certified senior advisors, that we have done the vetting for you, and the people that we are credentialing have the base knowledge, that they actually work together with a network to help support older adults. We do continuing education through thought leadership. I'm the editor of a trade journal that we publish 4 times a year, and we have authors from all over the country, sometimes all over the world, that are submitting articles to this journal to really make sure that our CSAs are up on the latest trends and latest conversations in the aging space. And we have a monthly webinar, an annual conference, there's volunteer opportunities. And the one thing that we do have is a directory listing and a digital badge so the general public can do their research. So just a couple of tips on working with an advisor. I think one of the most important things is really understanding the services that you're requesting. You know, we used to be in the aging field, we would go and ask our neighbor what they did with their grandmother or what their family experienced when they had a health crisis. And our healthcare system and our insurance system have just gotten so complicated that we really encourage people to work with a professional advisor and to understand what it is that you need, or have someone that will be able to walk you through the things that you don't know that you need. And make sure and ask about our credentials. You know, we've worked really hard for the credentials that we have. We do continuing education to make sure that they stay current. So don't ever hesitate to ask us what all those letters mean, and so that you understand. And let us know if you're interviewing advisors too. That's always something really good to say, you know, for us to be able to share with you what the distinguishing factors are between our qualifications and our experience level. Many people get into this industry, you know, they help a family member, and then all of a sudden, you know, they want to enter the industry. And it takes a lot of education to be able to be an advisor and truly understand everything in the industry. And the other thing is to really do your research. You know, you can look online. We never encourage people to put in their confidential information online, because there's a lot of marketing companies out there that will start sending you all sorts of emails. But, you know, definitely do your research and look at the different advisors. A lot of us are on LinkedIn is really, really popular. And many of us have Facebook pages and Instagram pages too. So you can do your research on how we're marketing ourselves, but you can also do research on our background as well. And I think one thing that I've learned over the, you know, last 10 years plus working in this industry is that we really ask that our clients be forthright in their disclosures with us. Sometimes families will hold information back, and or they're either embarrassed or don't want to be forthright in their disclosures with us for whatever reasons those are. We're able to provide much better advice when we know all of the current care needs, and also any kind of family dynamic or any kind of family concern that might be going on. So I put some contact information here. I'll definitely answer some questions after Jen shares. But Curtis Peterson is our National Sales Director. He's been with our organization for about 18 years. Wonderful guy. If there's anyone who's interested in becoming a certified senior advisor or know someone who is, I'm the editor of the journal. I put my contact information in here too. So Barbara, with that, I'm going to stop my share and turn it back to you.
Thank you so much, Kelly. And Jen, to finish us up, let's hear about you in Care Patrol, please.
Hi, thank you. I was looking at my presentation, adding my letters behind my name so I could speak to what Kelly was speaking about. Kelly and I have known each other for a while, and I think she brings up a lot of valuable points that I wanted to touch on. So I have been similar to Kelly, been in this industry for a while. I started as a registered nurse doing critical care nursing, care management, and then I transitioned to what some people call a placement specialist. I don't like the word placement, so I call it a senior care consultant. My letters, to Kelly's point. So I'm a nurse. I also have my CSA like Kelly, and then Kelly and I both, I think we actually did the test. We wrote the test together, are the certified placement referral specialist. And you will find, like she mentioned, there's a lot of people in this industry that don't have that background, don't have that certification, though. So that's definitely something you can look for. So when I'm speaking to placement companies and senior care consultant, what I'm speaking to is people who are free service that help you find a resource that is the right fit for you. So this isn't someone that is personally long-term with you, taking you to doctor's appointments and setting up kind of a continued assistance like Amy spoke to. This is someone that is more of a short-term in the sense of a couple months relationship, trying to find the best care option for your loved one. So the reasons why you'd reach out to a senior care consultant is if you have concern for a loved one's welfare, even if they're in another state, or if you're noticing your own difficulties. If you're interested in more socialization, if you're curious just what's around, or if you're curious about the buildings that you've seen, what their capabilities are. The terms I like to use is I like to help people that are not thriving at home. You can be surviving. Everyone can survive at home and be miserable. So I really hope that we can help people thrive. And you could try to look at your own. I mean, you could, but it is overwhelming how many options are out there. Deciding what level of care, what type of care, at what time in your life can be really hard. And having that conversation with yourself and with your loved ones that are, around you, your support system, that alone can be really hard for people. And unfortunately, sometimes people put this off until something happens, like Amy's, dad, something happens that all of a sudden you have to think about it. I really encourage people to think about these things and have these conversations with their support system before that happens. Unfortunately, that's not always the case, but that is something I think in my perfect world, everyone would have this conversation much earlier than they do. So there's many factors to consider when you're looking at what type of care you need. Is it a community or are you staying at home? Or are you looking at a home care coming into your home? What would that look like? How many hours would that be? Does it make sense care needs wise? And financially, does it make sense for you? If you're looking at a community, does that community support to have the care needs support that you need? And financially, does it make sense? Does a community have a good reputation? If you run out of money, does that community have an option for Medicaid or Innovation to pay them? Or is that community going to ask you to move out? Most communities out there, once you run out of funds or are unable to pay, they're going to ask you to leave. And as Kelly mentioned, the price of assisted living has drastically increased in the last, 4 years, probably, Kelly. Since COVID for sure. And it's making it hard for people to figure out does this option make sense for me? When you're meeting with a consultant, one thing I would like to make, going back to Kelly's comment, is to see if they have that certification. Do they have their certified placement referral specialist certification? A benefit to that is when you get that certification, they are expected to sign what we call the best practices. Best practices explains to them how there's expectations of the service they provide to you and the service they provide to the community. This is a free service to you because the community compensates them out of their marketing budget. In doing so, they need to be representing you when you go to a community, but also communicating efficiently with that community. That doesn't always happen. Unfortunately, as Kelly mentioned, there are a lot of people who go into this industry because they've helped someone in the past or because they used to have a related, not medical, not social work, but some kind of related industry. And they don't necessarily have that experience to be able to see if this community is the right fit for you. So you want to make sure that they have that experience and that they're coming from an organization that has that background. The first step when you work with a consultant is what we call a care discovery. They're going to probably start on the phone and they're going to talk to you about what you're looking for. What kind of care needs do you have? Where you live? And they should be able to meet with you in person, hopefully, before you go see a community, because they want to really get to know you. The consultants that work for me, we talk about, does it feel right for that person? And you can't guide someone to the community that fits them if you've never met them. It also helps determine a timeline. When you meet with someone, you can say, okay, you seem pretty safe at home. You have a good support system. You have a good social environment. You're just looking for the future. Or, oh, there's some things that we're worried about, and they can have that conversation with you to try to figure out when is it the right time for you to move. So the first step is that care discovery. The second step is referring to communities. You should have a list of every community that they're reaching out to on your behalf. You should learn information about every community they're reaching out to on your behalf, so that nothing should be a surprise to you. When they reach out to the community, they should be protecting you so that you don't get a million phone calls from high pressure salesmen. They should be protecting you in the sense of, this is what my client's looking for, this is when we're gonna meet, this is how often they want to be contacted by you. So that they're representing you, so you don't have to get all that communication. It can be very overwhelming. As Kelly mentioned, I have a slide on this too, is be careful where you put your information online. If you put your information in, you could be signing up for 10, 20, 30 phone calls from different communities. And that doesn't benefit anyone. When the consultant is reaching out to communities and referring to them, they should know that community's reputation. They should know that community's availability. They should know that community's price structure and if there's incentives. They should know that community and have been in that community before they refer it to you. So again, when you're picking a consultant, if you're working with a consultant, you want to make sure that they know what they're doing, that they know the buildings they're referring you to. The third step in this process is setting up tours. Again, that consultant should go with you. They should be standing by your side while you walk through the assisted living, or so it's independent living, assisted living, memory care, skilled nursing, 55 plus, all those different levels of care. When you're touring a community, they should be with you in that building. And they should be helping with that tour. They should be asking questions that maybe you don't know you need to ask. They should be pointing out things that you wouldn't know to look for. They should be able to ask about things that you had said were important to you to make sure that community has those things. A really common one is pets. People really want to bring their pets with them. You don't want an agent that brings you to a building where you can't keep your pet, if that is something you really want. It's a waste of everyone's time. The fourth step in the process is ongoing communication. After you do that tour and you are deciding, is this community a good fit for me? What's the next step? It depends on your timeline. What does that look like? Your senior consultant should be looking through, this is our next step. This is who we're going to communicate with. This is the people that you need. These are the resources that you need. Let me make those phone calls for you. They should be guiding you through the whole process of moving from your home to your new senior living community, so that you can focus on other things of what's the stuff you want to bring with you, and what's your timeline, what's that move-in day, you have a lot of things to think about. Let them take over those other pieces. The last step in the process is they should follow up after you move in. A good senior care consultant will be calling you after you move into the community, making sure that everything's settled in. It's really common for there to be bumps. You set up a new primary doctor that rounds in at your new room and they don't come when they're supposed to, or you're supposed to have these medications, but the medications didn't get filled correctly by the pharmacy. Like, things happen. And you want someone that's going to be there to help you with those little hiccups. You also want people that if for some reason this didn't end up being the right fit, they're still there for you. You want someone who, it's not like they move in, they collect their payment, and you never hear from them again. You should be hearing from them. When you're deciding that you are looking for some kind of senior care support or elder care support, whether it's home care, 55 plus, independent living, assisted living, memory care, or skilled nursing, you really should only work with one consultant. It confuses the communities when they're working with multiple people. You may be sending different messages. Your doctor is going to be getting calls from multiple people. That being said, do your research. Find a company that you has the right reputation, that has the right resources, that has the right certifications. Keep losing my place on my notes. Again, this is a free service. The communities compensate the agent after you move in as part of their marketing. So if you are moving into a community, you shouldn't be paying this consultant. There are other services that help with placement that you're paying for, but if you're working with a placement specialist, you shouldn't be paying them. They should already be getting paid. As Kelly mentioned, consultants should have experience and expertise in the industry and related fields so that they can help with that transition. Lastly, be really careful about online agencies. There are search engines, from what I understand, they're the same companies that own like Orbitz and Looking for Flight companies, where it's just an algorithm. You put your information in and they spit out communities in your area, and then a bunch of communities call you. So you don't want to accidentally get on one of those lists. If there is a community that you're interested in, you can always tell your agent, and the agent can reach out to them on your behalf, and they might tell you, oh yeah, we like this one, or oh yeah, we don't, and this is why. I think that's the end of my presentation. I don't know how well I did, so I guess we'll turn it back over to Barbara.
You did just fine, Jen. Thank you. I don't see any questions in the chat box. Does anyone have any questions? You could just kind of raise your hand or ask them now. Take yourself off mute and ask a question. I guess not. You ladies covered it very, very well. And I would remind everyone that part of what we do at AgeWise is provide information for you that you could find people like Amy, or you could contact CSA if you needed to for some reason, or you could contact Jen. You can also see assisted and long-term care rehab places online to get a feel for what they are without going and doing 27 searches. You can do it all in one place. And I guess we will get a few minutes back to our day. Jen, can you stop screen sharing? Thank you. I just want to double check one more time that no one else has any questions. I guess I would ask the one question of, you are not real estate people. Sometimes people get that confused with senior realtors. You're not finding them a condo or a patio home. Is that correct?
Yeah, no, I do partner with a lot of senior real estate specialists. I think sometimes that decision can be hard. Are you buying a place? Are you renting a place? Are you moving into a community? So in that sense, we welcome that conversation, and it's very common that you're working with a realtor and us at the same time, trying to figure out what the best option for you is. That's very common.
Okay, thank you. Amy, do you have any comments on that?
No, I think similar, that we work alongside a lot of other professionals like Jen, if that's the best route for the individual that we're working with, because they are essentially experts in finding appropriate housing or residential. So yeah, kind of
Great.
reaching out to different individuals.
Wonderful. Well, thank you for all this really good information. I hope it's helped everyone who's attended. We have to send this off to be edited. It will be up on our website within the week, probably. And again, thank you to everyone for participating today. Hope to see you at our next webinar. We'll be doing a series of home modification information starting September 11th, September 25th, and October 9th. We will be doing this in partnership with the Division of Housing. They have a tax incentive program and many other opportunities to help you if you want to stay in your home and do the necessary modifications or get modified equipment that helps your living circumstances with staying at home. So until next time, we will see you then. Have a great afternoon, everyone.